I'm sorry, I'm always mute. I was saying like good morning and good afternoon, everybody, and welcome to our Pandemia series. We're going to wait one more minute to let the other people, the other participants, to enter the room. Okay, it's past 2 o'clock, so we are going to start. Good afternoon, buenas tardes, everyone, and welcome to our 9th episode of Pandemia, the series that talks about COVID-19 and COVID-19 vaccines. In our previous episodes, we have touched very lightly on children because we have focused on different moments of the epidemic that we're living. So we decided that this episode is going to be focused on children because recently FDA has approved vaccines children's first older than 12 and then older than 5 years old. For these also, we have brought back two presenters that we have in different episodes because they are experts in dealing with this type of relation. They are two pediatricians from different parts of the country, and they're going to share their knowledge and the information and concepts about these vaccines in children. They are Dr. Ligia Peralta and Dr. Ilan Shapiro. Let's see. My name is Luis Alberto Mares. I work for the Latino Commission on AIDS. I'm the Director of Community Mobilization Programs, and I'm going to be the host and the moderator of this episode, as the other ones that you have, so you might be tired of seeing my face. So the Fear of the Pandemic is brought to you by a collaboration between the Latino Commission on AIDS and the COVID-19 Prevention Network. And today we have also the collaboration of AltaMed and Massachusetts Institute of Technology and Casa Ruben from Dr. Peralta. The format is going to be like follows. We're going to present Dr. Peralta and Dr. Ilan Shapiro are going to present about this very shortly, and then we're going to pass to the question and answer section of the webinar. I'm asking you all, please write your questions in the question and answer box so we can read it to the presenters. Also, this webinar is being recorded and it's going to be shared with all the presenters, all the people present in this webinar after we finish. And so I think it's all information to have. You are all muted. If you really need to want to talk, raise your hand. I'll handle that. But we ask you to please write the questions in the chat box. And now we are going to present Dr. Peralta, who's going to be the first presenter today. Dr. Peralta is a clinician resident scientist, fellow of the Massachusetts Institute of Technology and president and CEO of Casa Ruben Incorporated, an organization addressing health disparities in underserved communities. Dr. Peralta is an active member of the HIV Vaccine Trials Network and co-chair of the Latinx Committee of the COVID-19 Prevention Network of the National Institute of Health. Currently, she leads a new initiative addressing the needs of individuals recovering from COVID-19. As a clinician, researcher, and advocate, her interest resides in health disparities, HIV, chronic illnesses, and vulnerable populations. She was awarded the prestigious Massachusetts Institute of Technology Sloan Fellowship on Innovation and Global Leadership. Most recently, she served as the co-chair of the Incidence Committee of the United States Presidential Advisory Council on HIV and AIDS in Washington, D.C. She served as a commissioner on the Maryland Healthcare Commission, a regulatory agency addressing health system needs and accountability. She also served as the chief of adolescent and young adult medicine and the director of its adolescent HIV program and a founder of the Genomics Research Core at the University of Maryland School of Medicine, and many other things she has done. Very experienced Dr. Peralta in the field of HIV and also in COVID-19. So, Dr. Peralta, please go ahead.
Thank you so much. If I can have the first slide, I would like to describe myself as a clinician and clinician scientist with the roots in the community. So it is with great honor that I'm participating in this today with Dr. Shapiro. So the main question that every parent is asking to themselves right now is why vaccinate our children and why now? Well, we are approaching basically what I always call the perfect storm, which is the presence of the Delta variant. We have heard for 8 sessions before about what this is. This is a variant that is more contagious, is more virulent, is producing more disease in children. Before we didn't see so many children with symptoms or going to the hospital. Now we do. But also because we still have people who are unvaccinated or under vaccinated, for example, our own children. And because we're facing the winter, and this is what we are talking today, we have 2 major viruses, right? We have the COVID-19, and also we have the influenza, A and B, that hit very, very, very hard our children, especially those 5 and under. But also we have RSV. We, this year, face RSV a lot earlier than any other year. So normally we see a lot right at this time and beyond, but we saw it earlier. And also we are approaching what I call the holiday transmissions. This is when the big holidays are happening, Thanksgiving, and also the religious holidays of Christmas, Hanukkah, and others. So we really have a combination of factors that are putting our children at risk. And one of the issues that I always ask parents, if you would like to wait, what would you like to wait for? For your child to be, who is already at risk, because no child is immune to get this infection? Or can we do something about it earlier if we can discuss the vaccines and what we have right now approved by the FDA and blessed by the CDC? So let's set up the stage a little bit, because we know a lot about this, but we do know that children are not immune. And if you can give me the next slide, Luis, we know that children are vulnerable, but also they are great transmitters of SARS-CoV-2. So they are not only effective at transmissions, but they are also in the areas where we see the transmission happening, which are schools and the indoor spaces that are closed, but also in their homes. So the Delta variant spreads easily in indoor spaces. And this is really where we see, for example, in this slide, that if one person who is the contact person is unmasked, how many, and you can see that in the right side, how many other individuals, not only in that school and other students, can be impacted by this, but also at home. And those students are taking that vulnerability at home as well. So we have a cascade of events that are putting really our other children at risk, especially those who are under 5, who's still not eligible to get vaccinated. So schools do a great deal of work, especially in some states more than others. Some others are litigating the mask, how to wearing the masks or not. But we know that those mitigation factors, those mitigation activities of wearing the masks, getting vaccinated, staying at home if you're sick or your child has any symptoms, and also testing routinely at school are very, very effective methods. So with that, let me talk a little bit about why children are at risk of serious disease. So go to the next one. We know that the majority of kids are not getting very, very, very sick. However, we know that kids of color are very much, overrepresented in what we call those children who get inflammatory syndrome. It's called MISC, but it's really inflammatory syndrome of different organs that are a result of COVID. And one of the issues that we had early on in the pandemic is that we were really not capturing all the data, because remember, we were focusing on the adults. We were focusing on not only testing, but testing the most vulnerable and where the mortality was very high, those above, 65, 70, 80. So the data was really lagging in terms of those children. And now what we see is not only that they are vulnerable, but they are at risk of very serious disease like the inflammatory syndrome. One issue that we know is that it is very difficult to predict what child is going to have this. So although many children may not get serious infection or serious consequences right there of COVID-19, we do know that they can get serious disease, but we cannot predict who is going to have that. We know that children with underlying conditions like asthma, diabetes, etc., are a higher risk, but we know that there is 1/3 of them or more that we don't know exactly how to predict who's going to get sicker or not. The other thing that we know is that they also get post-COVID-19. And many people, is what they are calling now the long COVID. Many children really couldn't express exactly what they were happening. But now with better trials, and the NIH has expanded the trials also to be able to study that in younger ones, we are looking at that, the consequences, so the long-term consequences of COVID. Again, the good news is that many of these kids could recover within 3 months or so, but there are some others who may have post effects, especially if they have had inflammation of the heart, if they have had inflammation of at the muscle level, the lungs, or even the brain. And those are the long COVID symptoms that are similar to adults, whereas there is just a little change in behavior, but at the same time, there is also change in the way that they are concentrated, the way they are learning. And those are probably the things that we are noticing in children that are unique, because they are not able to say that they have not been able to smell or taste for a long time. So what we see is the consequences of the post-COVID by that, inflammation that stays there and that allows them to kind of perform their daily activities, but not at the same level that they had before. And when they go to school, they have problems concentrating or kind of learning. That is the difference that we see in little children. So one more thing, and you can show the next one, that I think is important for us and for the people who are tuning in to us today, is that when we look at that, inflammatory syndrome, the median age is 9 years. So this is what we have vaccines now from 5 to 11 years of age. So we are able to prevent this from happening. And we have, up to September 2021, we have about over 5,000 cases of those reported in the national surveillance as per CDC. The sad news is that 61% are among Hispanic Latinos or Black non-Hispanic. So we are overrepresented there. So we have, we all know now the good news about having the COVID-19 vaccine fully reviewed by the FDA. The clinical trials cut no corners. And the 5 to 11 years of age Pfizer vaccination is already approved and blessed with the guidance by the CDC. So this is a different formulation. You can see it there in terms of not only the color is different. For example, the Pfizer for adults, the top of the vial is purple. This one is orange. So we not only have a different formulation, we have different dilution and a different dose. So the bottom line is we give 10 micrograms, which is 1/3 of the dose that we give to adults. And it is given pretty much on the same side, which is the arm, the deltoid muscle is given in the muscle, and it's safe and effective. So there is a 90% response, and it's a good response in those children. But remember, they need 2 doses. One when, the first one is given, and then 21 days later, the same as adults. We still have no information about the durability of the after the second dose of the response. So we cannot have any data right now to share in terms of needing a booster in the future, which many parents ask at the time of vaccination. But right now we know that they have a great response and they are very, very safe. The other thing is they have very little side effects. So most of the side effects that from day number one, when we open up our shop, we already had the vaccines and the FDA approved. That same night, we started vaccinating children. And basically what they get is a little soreness in the arm, the same as adults. And some of them will get tired or more sleepy perhaps, and rarely we see a fever, but it's very similar to other pediatric vaccinations. The dose is 10 micrograms, so we are not seeing a great deal of side effects. And the next one of the things, Luis, the next one, please, the slide. One of the things that I would like to address is the myth, right? The myth that we see in every single vaccination site. So what are the long-term side effects? That is going to impact the DNA of my child? The answer is absolutely not. It doesn't enter the cell at that level. And the second thing is, for some of us who have worked on mRNA, and I'm coming from MIT, where that research was conducted for a long time. My professor started doing this in 1976. The first paper was published at that time. What we know is when that RNA, which is a messenger, basically, given the recipe to the cells to learn how to make that protein and then the response, basically what happened is that within several hours, it disappears and we have no trace of it. So there's really no DNA change whatsoever. Also, another myth is about, the quick rollout. So again, there were no cuts in terms of how to conduct the trials. In fact, I can testify that 3 of my grandchildren, 2 who are above 5, participated in the trial. And now the 3-year-old is participating in the one under 5. And this is part of what many, many, many kids are really giving the testimony about how great they feel about participating in helping other kids and their families. So the other one is about food allergy. Many parents who are concerned about allergies for their kids, we follow the same guidelines we always had. Remember that there is no egg or any other components, aluminum and otherwise, in those vaccines. So there's not much that we had to be concerned about that, except that for those patients, we usually observe for 30 minutes just to make sure that there are no effects whatsoever, but we don't have concerns about any interaction with other allergies. Also, let's talk about the fertility issue, because this is the big elephant in the room. I get this in every vaccination, and we do sometimes 2 and 3 schools a day. There is no data whatsoever about changes in fertility in anyone getting RNA vaccines. In fact, studies have been done in adult women, studies have been done in pregnant women right now, and also studies have been done in males in terms of fertility. We have not been able to find data that says that this is of worried. But what the parents think is that what is going to happen in the long term for my child? Again, there is no alteration in any DNA to be able to impact your child. So there are 2 things that are in the news a lot. I think we just need to mention them. One is about, the administration of the vaccine. And some of you have heard, for example, the deviations or errors in terms of, the formulation. These are not common, but they have occurred, especially at the beginning. One good news is that at the national level, the White House basically has given the vaccines to the community now to be able to be implemented by pediatricians and pediatricians' offices and also in schools. And again, although there have been some deviations, the majority of the individuals who are doing this really follow what we know in pediatrics for many, many, many years, which is the vaccine for children, which are federal regulations in terms of how we manage that, how we dilute it, all the temperatures. And again, make sure that you ask all the proper questions. For example, if you face parents or their parents in the audience, you ask the questions about, what is it? I get it every day. Now, how much are you giving to my child? Well, what formulation is this? And is this for adult or is this for children? This is okay. This is what a concerned parent should be able to ask. So next one. So I just want to say that not only, vaccines are good and effective, but also vaccines work, because another concern is, well, so after vaccination, is my child going to be at risk? We know that the majority of individuals, the greatest majority, are the ones that, are responding very well. They don't get symptomatic COVID. The ones we get concerned, and that's why I put that graphic there, are those that, especially when we got the data in July of this year, are the ones who have immune compromised system, meaning that they really don't get that response because their immune system is weaker by age, or weaker because they have other conditions or other perhaps treatments at that time, like individuals who have undergone cancer treatment, etc. So those are the ones we get concerned about, but especially those above 65 years of age, especially in their 80s. The majority of the cases that have been seen and tracked in terms of breakthrough infections with symptoms have been in those individuals who are really aging and have many other conditions that impact their immune system. That's very likely to be very different in children. Next one. So just to put things into perspective, I mentioned that this is the winter time where we expect that there's going to be an influx of viruses, including the influenza. And one of the things that parents forget is that there's really, even if we are great clinicians, Dr. Shapiro and I practice this all the time, it is very hard to differentiate influenza from COVID and other like RSV symptomatic, because they could just have the fever, the feeling sick, the achiness, and not feeling like themselves. So this is one of the times when I tell parents, seek medical advice. We have tools to be able to differentiate the viruses and also to be able to diagnose them. It's very easy. Remember now the swabs that we put on the nose don't go that far. So, many children really tolerate that very well. And I can tell you, we've seen in my own practice, babies up to 1 month of age with COVID. And now we swab them in a very nice way that doesn't make them uncomfortable. But the same thing, remember, influenza is very, very risky for those children under 5. Hopefully at 5, we got them immunized for COVID and influenza, but we do have influenza vaccination for more than 6 months of age. At the beginning of life, they get, their defenses for influenza from their mom, and their mom already got their vaccine. So we have tools to be able to stop the influenza and avoid that they get very sick. Last year, influenza was not that high. Because all kids were we were protecting them. We were at home most of the time, and only essential workers and other people were working outside. They were not going to school, the majority of kids, so we were protecting them. But this year is going to be different at home. So just few signs for emergency. If you have a child that is not responding, that is changing their behavior, that is not urinating enough when we're concerned about dehydration, or you see that the ribs are pulling in difficulty breathing, or bluish lips or face or hands, this is the time. High fever that doesn't break through, this is the time to really get the warning of those emergency signs and seek medical advice. And then I just want to tell you that we've been doing this again since the day of the approval. Casa Ruben goes out to the community. So this is really, Dr. Shapiro and I are really like very excited to be able to take this, because we always take care of the child and also of the family. So the vaccination for children it has a little different flavor, because the child is one patient, but the family is another patient. So we take our time not only to really tell them about what the vaccine is all about, what to expect about the vaccine, but also what doses they get and what kind of dose we are giving to them, what kind of vaccine we are giving to them. And the fact that we are protecting them, but they are not fully protected yet, because this vaccination is just the first shot. Then they need the second vaccine in 3 weeks, and 2 weeks later is when they really mount this very good response to the virus. So they are not protected yet. It takes a whole 5 weeks from the first dose for us to be able to say that that child is already getting the immunity that we need to be able to protect them. So we take our time. And one of the things that we did initially was not only to get out to the community, partnering with schools to make sure that we provide, the pediatric side of things. And I encourage many of you to have these collaborations with your, public schools, other schools, and also the health departments to be able to help them, because pediatricians have been doing this forever. This is what we do for a living. And now this is a time when we can contribute to the community right there on site, where we really can get not only the expertise, but also be able to be present with the community to answer many of the questions and be able to put the fears at ease. So with that, I would pass it back to you, Luis.
Thank you very much, Ligia, for your presentation and for clearing us up for this summary of what's been happening in children and COVID-19. And now we have Dr. Ilan Shapiro, he's a medical director in health education and wellness at Altamed. So though Dr. Shapiro has only been with Altamed since 2016, he has already made a significant impact on the organization and the greater communities it serves. Dr. Shapiro is a tireless advocate for healthcare equity with a deep affinity for innovation and public health policy, especially related to the Latino population. Currently, Dr. Shapiro serves as Altamed Medical Director of Health Education and Wellness, helping to create and implement programs and services that expand access to care and improving outcomes to the community. Between 16 and 17, the year 16 and 17, he also served as Medical Director of Behavioral Health and was instrumental in strengthening the practice and expanding Altamed's offerings and create the employee health department serving more than 3,000 team members. One of his biggest accomplishments at Altamed has been the development of a dedicated Altamed Health and Wellness facility. The center uses the latest technology as well as additional evidence-based principles and a hands-on approach to teach members healthy habits related to nutrition, fitness, and chronic condition management. The center, located in Santa Ana, will serve as a prototype for future sites in Los Angeles and Orange County. This is a reflection of the combination of technology and innovation efforts to bridge new offerings and underserved communities. As you can see, both our presenters are very much focused on health equity and provide services to the people that need the most. And this is what Pandemia is about, bringing information to Latino communities. So, Dr. Shapiro is also a star in television.
Thank you so much. It's an honor, Luis, to be back here. And Dr. Peralta, I'm going to actually copy paste your presentation later on, because I think that it has been a very interested and very thorough explanation of absolutely everything. Then I'm going to steal the screen for a second. And Luis, I'm probably going to give you some headaches right now, but I'm going to do it myself. And after that, I'm going to ask you if you can retake the screen. But I wanted to show you a video. This video is a personal video. And I hope that you hear something. And if not, I will tell you what happened afterwards. If you're not hearing it, he's asking to actually get documentation of what's happening. He got the shot and wait for it. He just said that it tickled. And that's a completely first for me. Then he actually said it was tickled. And by the way, that's my son. And my daughter, I have another video from her. And she went like, oh, that's it? Then let me tell you, and this actually the part of where science meets a pediatrician / gets in front of a father / a human being, it's totally okay to be afraid. It's totally okay. A lot of the conversation that we're having is like, no, you're anti-vax or I'm pro-vax. No, I'm supposed to be feeling, that I'm super pro-vax because I got the shot. And we start having a lot of dreaming moments and we forget a couple of things. We have feelings, we have families, and we have doubts. And that's awesome to have doubts because that energy, if we use it well, we can use it to protect our kids. One of the important things that I felt, and I'm going to share with you how I ended up making sure that to decide what was the best choice for my kids. First of all, we know that being afraid works amazingly well when you have a tiger, a lion, or a shark, and you need to move forward fast. That way you don't even think, you move fast and you move forward. But right now, we do not have a tiger. We do not, right now, we do not have a tiger. We do not have any type of problems out there that can actually justify the fear that we're having right now for the vaccines. Then we need to put that fear and use it to help us figure out something. Then I'm going to put that fear that I had as a father on the side. Then I needed to decide, what would be the best thing for my kids? Because for me, it was clear, me as a pediatrician, someone that was in the community, helping, being part of everything, then I needed to make sure that I was okay to protect my family in order to protect my community. And for me, it was clear. Then why I decided to move forward with my kids. I started to see something interesting after 4th of July, and Dr. Peralta actually shared that with us. Cases were not going down for kids. Actually started going up. If you see how many kids were sick in the past weeks, we had almost more than 1 million kids, new cases of kids actually being sick from COVID-19, from the almost 6 million cases that we have in the entire pandemia. Then you can see suddenly everything shifted, and we know that kids were more they were going out there to community. There were more touch points with more people. We had the Delta variant that came to do a lot of havoc and headaches to all of us, especially as parents, because in the old days we were like, no worries, just a simple cold, they will be fine. On reality, that's not the case. We're starting to see a lot of the hospitals, pediatric hospitals, having more cases, more kids ending up on the intensive care unit, and most importantly, two things that we saw in adults that we were not seeing in in kids. We're starting to see something that it's important to share it, and that's something that I was very afraid of because I was seeing it as a pediatrician and also reading about it, that kids were starting to come with headaches after surviving COVID-19. And I'm using surviving because, because kids are, the mortality rate is lower. That doesn't mean that they don't have scars somewhere. Then we start having headache. More common because of the infection rather than anything else. Then, I had all this stuff around me that needed to be taken care of. And of course, I knew that my kids needed to be at school, that needed to, again, restart the development, the educational part, the socialization, a lot of things that we have as parents that we want their kids to be there. Then putting everything in context, I started seeing the deadly effects of COVID-19. I started seeing all the headaches that it was giving to us, I was starting to see in my own patients, kids that survived COVID-19 that were starting to have that. And I started actually managing a lot of the post-inflammatory syndromes from COVID-19 in pediatric patients. And it was clear for me that the almost half of the human population has been vaccinated. In the US, more than 200 million people are at least vaccinated with one vaccine. And if we go lower, from youth, we have millions of kids already vaccinated. And we have an amazing research group from 5 to 11, where it was safe, effective, and that gave me peace of mind. Why safe? Because they measure everything and they saw that, kids, yes, they will have side effects. Yes, familia, I will now, yes, there's side effects. There will be some redness, some fever, some chills, maybe tiredness. And that was about it. Actually, my kids had only pain on the arm, and that's the most common one. And nothing else happened. We were playing soccer in the evening, and they had like Friday school, and Saturday we went to the soccer games, and everything was like normal. For me, it was a different story. I felt a little bit more tired and the pain on the arm, but my kids were like that. And by the way, we gave the 2 shots, COVID-19 plus influenza virus vaccine at the same time, the flu shot and the COVID-19 vaccine, because it's winter and we need to protect our kids. It was clear for me that all of this information was what I needed. Plus, apart from being safe, it covers 90% against COVID-19 and the complications of it. Then, it's safe, effective. We want to actually have a different winter because, and I'm actually acquiring this term, we have the golden weeks right now. If we all get protected, get our boosters, and most importantly, protect our kids right now, our Christmas, our table in Christmas, our New Year's will be way different than the one that we had last year. It's true. Why? Because we know that vaccines, last year, we know that, we have, first of all, Halloween, that we start to see the peak. We're starting to see, it's Thanksgiving is coming. And trust me, people will move. And that's perfectly fine if we do it safely. And part of that safety net, it's creating barriers between us and the virus. Then, yes, it will be a way better winter on the feeling that we already have the vaccine and we can do something about it. And we already saw in summer that the people that were actually getting sicker and actually ending up on the hospital at larger rates were people that were not vaccinated. Then, in order to protect my kids, in order to protect my family and be ready, because as we heard it from Dr. Peralta, it takes about 6 weeks to get the fully benefit of being protected. We need to start vaccinating today and getting, at least starting the conversation, because the sooner we start with that, the better we'll be protected for Christmas and New Year's. Familia, that's the part of me, and I really wanted to interact with questions. I think that's going to be one of the important things, but always ask questions. Remember, it's okay to have questions. It's okay to have doubts, but most importantly, you need to move that fear to actionable things, to get the data, to get where are you in this process. And we are here. There's a lot of Dr. Peraltas, there's a lot of Dr. Shapiros, and there's a lot of amazing people like Luis that actually open the conversation in a lot of forums. It's way different than a couple of months back, where vaccines were like, oh my God, there's one vaccine in this corner, and you knock on the door and you need to do the code and do the wiggling thing. Right now, Familia, we're giving it schools, pharmacies, community health centers, hospitals, even churches. Then please, just do it. Think about it. And by do it, I refer start the conversation. We need you there. Thank you so much.
Thank you very much, Dr. Shapiro. And same as you, also had 2 vaccines, and the following day I was in bed all day. My third also was for COVID and my one for influenza. I got them and I feel safe now. So we're going to go ahead with the questions. We have some questions already in the chat. And okay. So this question says, since children have undeveloped immune systems, Can vaccines mess up the immune system or overload it? What do you want to
So I'll start with that one, because this is a great question, and something that I have done a great deal of research on. Everyone knows that when we are born, we need some time to be able to kind of mature certain areas, right? And one of this is that we are born basically with the immune system of the mother, meaning that she passes the defenses, right, that she already has through the placenta to the baby. And then the baby, gets protected against certain infections that she had been vaccinated for. But one thing that we know is that we start vaccinating early on these days. For example, at the time of delivery, we give the first hepatitis B. In the past, we used to give it later on in life. Then in adolescence, I remember that time. And then now we do it right from the beginning, because that protection is important. And also, that vaccine not only protects, for future infection, but the infection is, they happen to be exposed at that time. However, one important thing that happens in children is that at the beginning, let's say when you are 5 years of age, when you are 3 years of age, when you are 4, you already have certain mechanisms that are very strong to produce those cells that we need to be able to get a very, very good response to vaccines. And that is, just to give you an example, the gland that is right on top of the neck, right at the front of the neck, is called the thymus. And if I use a culinary term, and in Mexico they use that too, is sweetbreads or molleja, for example. But that is a delicatessen that we eat. For example, the baby cow has it, and French people are really, they specialize on that. But that gland, which is right there in the front of the neck, is very important in children, because it produces not only these cells that are right up front fighting the infection, but also the specialized one that are memory cells, which are the ones that we also use when we give vaccinations. So although just at the beginning of life, they are developing all these mechanisms, we know that children respond very well, but also that's why we give boosters. Remember, children get lots of vaccinations at the beginning of life, and they get boosters, but once they have that, they respond very well. They have the best responses in terms of cells that attack the infection. They have the best responses in terms of immune responses, meaning those, inflammatory responses that fight the infection. And we be losing that over time. That's why people above 65 years of age has less response, and they need sometimes a different dose, for example, of the influenza vaccine. So children really are not underdeveloped, and this vaccination doesn't produce any effect on the immune system. On the contrary, we know in pediatrics that now we combine vaccines because that makes the response stronger and more durable. That's why we combine vaccines for children. The second thing is that the booster is important, because we really call on these specialized cells to make sure that they also respond in the long run. So again, in the studies, over 90% of response to this COVID-19 vaccination with 1/3 of the dose of adult. That means that the response was extremely good. And also that means that with the first dose and the second dose, we have children who now can be protected against COVID-19. One thing that happens in the data was that they really didn't see any any symptomatic infection, meaning that they didn't develop anything, even if rarely they tested positive, very, very, very few cases, but they have no symptoms whatsoever. So this is a very safe vaccine, and also their response is probably the best. The other peak of the response is at age 11 and 12. That's why also in pediatric, we give vaccinations in that platform, because it is extremely, extremely good response. And that gland that I mentioned there, the sweet bread, it's still active, still making those specialized cells that respond to vaccines, and also in the long run are specialized to respond to the infection and fight it. So we have great responses. The bad news is for some people who are already like over the hump, above 65, that's when we start, the immune system starts declining, and that's why people may need the booster vaccination for other things. They may need, they need a higher dose for influenza, but also they need a booster for the COVID-19 for that reason.
Thank you, Dr. Peralta. Dr. Shapiro, I know you have a lot to say about it, but I think somebody's asking you, maybe you can say something in Spanish, en algo en español para la comunidad latina que también está aquí, no entiende muy poco el inglés. Están pidiendo si puede una...
Let me press the translation button. Con mucho gusto le hacemos la presentación en español. Es muy importante esto porque la pregunta era, ¿qué está pasando y si nuestros jóvenes y niños pueden tener una, digamos que su cuerpo no aguante toda esa información genética y las vacunas y así? Nos da miedo como papás. Y parte de lo que estaba diciendo la doctora Peralta, y voy a tomar un poquito de su idea y luego voy a decir lo mismo, es lo siguiente. ¿A qué hijo no se le ha caído comida al suelo o no se le ha caído el juguete y se lo ponen en la boca? ¿O qué niño no juega en la tierra? Cuando nosotros tenemos cualquiera de estas acciones, si nosotros medimos cuántos antígenos y cosas están allá dentro, desde plomo, porque hay plomo en la tierra, tétanos, bacterias, virus, parásitos, todo está viviendo allá adentro, incluyendo insectos y todo lo que pueda vivir. Y Oquilis es mucho más al momento que ellos agarran un puño de arena, un juguete que se cayó o están jugando en la tierra, que realmente las vacunas que estamos dando. Entonces, realmente nuestro cuerpo lucha a diario con miles de infecciones y ni siquiera nos damos cuenta, porque nuestro cuerpo está, desde que nacemos hasta el final de la vida, nuestro cuerpo está todo el tiempo luchando con el objetivo de realmente salvaguardar, cuidar completamente todo lo que estamos viviendo nosotros. Y por eso es sumamente importante esto, que sepamos que como padres se vale tener miedo, se vale realmente tener esa preocupación de qué es lo mejor para nuestros hijos y muy importante, tomar acción. Tomar acción porque, y lo estaba compartiendo en la parte primaria de esta conversación, nosotros tenemos como padres a escoger de qué manera vamos a mejor proteger a nuestros hijos. La mejor manera de proteger a nuestros hijos es, y lo sabemos todos nosotros, no es que somos pro-vaxxers o anti-vaxxers, se vale tener miedo, queremos lo mejor, estamos preguntando. Entonces, pregúntenos. Estamos aquí dos pediatras, la doctora Peralta y un servidor, para responderles lo que necesiten. Y la idea, y como les comenté, que yo vacuné a mis hijos, es que realmente el virus del virus de la COVID-19 está pegándonos mucho peor. Nos está realmente dando problema de millones de niños ya contaminados. Niños están teniendo algo que se llama el COVID prolongado y están teniendo problemas de dolor de cabeza, el corazón y otros problemas más a largo plazo. Entonces, estamos viendo esa parte. Por otra parte, muy importante, la vacuna que nosotros estamos utilizando de COVID-19 y las vacunas en general para todos los niños tienen cero evidencia que puedan crear problemas de autismo, porque lo vi en las preguntas que nos están haciendo. Entonces, familias, no se preocupen. ¿Y cómo sabemos esto? Porque hemos visto muchas cosas. Esto empezó por un señor que hizo un artículo que agarró 10 niños y dijo, por cierto, puede ser que esté referido con estas cosas. Entonces, desgraciadamente, por culpa de él, muchos niños han muerto de sarampión, rubiola y otras enfermedades más por esa vacuna. Entonces, familia, no se preocupen. Yo vacuné a mis hijos y yo pensaría que estaría pasando eso. De la misma manera que vieron el video de un principio, es mi hijo, no es el hijo, o sea, virtual que me inventé ahorita. Entonces, realmente creo en esto y la misma manera que Por eso la mayoría, y para eso es más arriba del 95%, 96% creo, de todos los médicos y la gran parte de las enfermeras en Estados Unidos nos hemos vacunado de todo. ¿Por qué? Porque sabemos que es la mejor cosa que podemos hacer para nosotros. Y si queremos tener un diciembre bonito, con una mesa de Navidad, con calor familiar, queremos realmente terminar el año nuevo de una manera increíble, de la manera que no hemos tenido durante casi 2 años. Depende de nosotros. Y por eso es tan importante realmente en este momento crear barreras para nuestros niños. Hoy tenemos 2 semanas y ya se está dando el tiempo para que realmente le pongamos las 2 vacunas y estén completamente vacunados y protegidos para ese tiempo. ¿Por qué? Porque ahorita estamos viendo que los adultos necesitan justamente ese booster shot hoy. O sea, si ya tuviste 6 meses después de haber tenido tu segunda dosis, o Johnson & Johnson y 2 mesecitos más, pónganse la vacuna y se pueden combinar, es lo precioso. Y antes estaba difícil, que teníamos que hacer muchas cosas para hacer, ahorita prácticamente está en todos lados. Entonces, nos tenemos que preparar hoy, tomar decisiones hoy y, ahora sí, curarnos de todas las dudas que estamos teniendo el día de hoy para tener un diciembre completamente diferente que no tuvimos el año pasado.
Muchas gracias, doctor Shapiro. Doctor Peralta, ¿quiere decir algo?
Sí, en español, porque
Sí.
alguien preguntó sobre el autismo, que tiene un niño autista o niños con problemas. Estos niños son sumamente vulnerables. Son niños, acuérdense, que uno tiene que tomar muchas decisiones y hacer muchas cosas para poder protegerse. Pero estos niños no solamente no les va a dar autismo, sino que si ya tiene autismo, tenemos que cuidarlos. Tenemos que cuidar nuestros niños que tienen otras condiciones. No debemos tener miedo de que tengan, por ejemplo, asma, de que tengan alergias. Como ya les dije, las alergias a los alimentos o a otras cosas. Es lo contrario. Esta es una indicación muy importante para proteger a su niño. Y lo otro es, acuérdense que los pequeños de menos de 4 años para abajo todavía no tenemos vacunas para protegerlos y es muy, muy importante protegerlos de este virus Delta.
Muchas gracias, doctora Peralta. Un saludo también a las personas que están atendiendo este webinar desde Corona en Queens, que fue un epicentro de la pandemia aquí en Nueva York. Y están muy interesados en saber, por eso pidieron que lo hagan en español, porque la mayoría de ellos son familias que hablan español. Así que bueno, están escuchando ustedes a la doctora Peralta, al doctor Shapiro, la información que les han dado, que es muy importante, ¿no? Que vayan a vacunar a sus hijos, si quieren que tengan una buena Navidad o un buen siguiente año. Creo que nos queda tiempo para un par de preguntas más. Por allí vi, decía, ¿vieron? ¿Se lo dijeron? If a child is not in childcare or is being homeschooled, do they still need to get a shot?
Yes, they do. Yes, he or she does, because well, when I show one of the slides, and we know that in our families, and the people from Corona can testify to that. There is always someone who's working because it's an essential worker, someone who really has to come out of the house to really earn that money that we need to sustain the family. That person is exposed, and this is why we need to protect our children, because we, unfortunately, and this is the majority of the cases that we see in our families of Latinos and African Americans, is that many of the parents had to work, right? We were really sustaining the economy, and unfortunately the family got the COVID after that, because it comes home. It is, this is the place where we hug each other, don't cover because we are not eating with a mask, right? So this is exactly where we need to do that. And that child needs to be protected, and protect anyone who he or she plays with who is underage or someone who really has a very weak immune system.
Okay, well, we're reaching the time limit for this webinar. Thank you very much, Dr. Peralta. Thank you very much, Dr. Shapiro, for being with us here again and sharing this information on children, which is your specialty. And thank you, everybody, who attended today. We're going to have again, in a month, approximately another webinar in terms of what's happening with the pandemic. focus from a different point of view. I think we already have a team. We're going to focus on how our religious belief influence in our decision to take the vaccine. So we're going to have people from different religions talking about the influence of how they think about vaccine. Thank you very much, everybody. Thank you again, Dr. Peralta, Dr. Shapiro, and our immense gratitude for your presence here.
Thank you.